I'm Michael Barbet. I live in San Francisco with my partner and our 2 dogs, Riley and Lulu, and I'm a survivor of congenital heart disease. I was born with a bicuspid aortic valve and aortic stenosis, meaning one of my heart valves didn't open or close properly, and an aortic aneurysm. I grew up in a relatively tight-knit family with my parents and my sister. My disease process was a heavy part of my childhood and something that I was constantly reminded of.
Congenital heart disease affects nearly 1% of live births each year, which is about 40,000 cases in the United States alone. So not that rare, but it can range for something fairly simple that you may not even know you have to more complex conditions that can be life-threatening. Ideally, you diagnose this early, often before birth, so that the parents and the care teams and support system are ready to handle whatever comes next.
There were different, moments throughout my childhood. Like I had a couple fainting episodes, arrhythmias. The true symptoms didn't come until I was closer to 25. And I remember walking up these steps and feeling like really unusually fatigued. And then that persisted for a few weeks, and I started experiencing other symptoms, like kind of get blurred vision. I would walk a few blocks and kind of feel like I needed to faint. And that's when I thought, it was time to call my cardiologist again. I remember getting the echocardiogram, and I saw kind of one of the key data points, which is kind of the pressure in the left ventricle, had basically doubled. And I called my parents, and I cried, and I couldn't control it. It was a moment I had waited for, since birth, something I always knew was coming, I didn't know when. I just felt kind of overcome with fear. I went in for surgery. I told my parents that I loved them. I knew that it was a possibility that would have been the last time that I said that to them. They took me back. I looked up at the ceiling, and, it was actually one of those few moments in life where I felt absolute peace. The surgery lasted several hours. I was on a bypass machine for 2.5 hours. There was a point where I was placed in a state of deep hypothermic circulatory arrest for 15 minutes. They had to cool my body down drastically to protect my brain while they worked on the aorta. For that period, I experienced a clinical death. I woke up in the ICU, just like I told, my parents that I loved them before I went under. That was the first thing I said when I woke up too. And then I also told them that I was a rock star. That kind of set the tone, for, the rest of my recovery.
Michael was very fortunate to have a very supportive family and an excellent healthcare team, as he's told us about. But the emotional, physical, and financial toll of congenital heart disease on families is immense. Families need to feel supported so that they can focus on what really matters, the health and their well-being of their child. That's why the American Heart Association works every day to ensure that healthcare is affordable and accessible so every child has a chance at a healthy life.
My wish would be that every person, with congenital heart disease has the same access to quality healthcare.
So in efforts to help our patients with congenital heart disease, the American Heart Association has advocated relentlessly to support cardiac rehab coverage across the board, especially after our patients have complex surgeries. We are a science organization, so we have strongly supported and funded research that really helps us, again, from the discovery stages of new ways to prevent congenital heart disease all the way to advanced, less invasive therapies to treat our patients with congenital heart disease. And lastly, we have a network just so that caregivers, survivors, and patients with heart disease, congenital heart disease, can work together to support each other. We know community is really important.
It's really a special organization that's creating an outsized, impact. Very few people in life are forced to confront their mortality so soon, which is terrifying. And it was terrifying for me, but that gave me such a special perspective that I carry with me day to day. And that perspective is invaluable.